Okay. Now, I know I did the bios, the accolades, the highlight reel, but I want to kind of start with what we mean when we say Black maternal health care, and not just the crises of it, but also the work you do in this space and the joy it gives you. And then we'll get into the harder things. Steffi, let's start with you. Hello.
Thank you for the question and for opening up this space in terms of, for me, Black maternal health, the anchoring for it is community. It is being in relationship in a way that feels authentic and is unapologetic in terms of the diverse experiences and expansion of care that's needed for Black birthing bodies and across the perinatal spectrum. Yeah.
Yeah, also appreciate the question. Appreciate you calling in Joy and bringing in Chrissy. I think it's about remembering too. I think, in our path to open this birth center, there's often the comment like, oh, that's so new and different and alternative. And we're like, no, the midwives and Black midwives have been catching babies since the beginning of time. And so I think Black maternal health is also about remembering and reclaiming ancestral wisdom, ancestral technologies as a way to heal our communities, and in doing so, to improve the system for everyone.
Come on. I think, first of all, thank you for having us, but what I would add is awareness. I feel like we're in a space where bringing awareness of what's happening to Black women and Black birthing people that has probably been silent for a very long time. And not only bringing awareness, but now let's talk about solutions. How can we change those statistics and make sure people like your friend and other family members do not have to suffer the same fate?
Yeah, thank you also for the opportunity to be here. Black maternal health, I also believe, is about freedom and liberation. It's a movement about us deciding for ourselves, like how we want to envision a future of our own design. I think about the literary ancestors we have, like Audre Lorde, or I think about Octavia Butler, and the opportunity to use futurism as a prism to build and think about how we can, create something that works for us and by us. And so it's an opportunity, I feel like, to lean into fellowship and to our community and all the ways that we've always come together to build solution, but in a way that was always imaginative, right? And building that with the resources that we've had, which we alchemize things that have been given to us that were actually meant to harm us, and we transform that into the gifts that we put into the world. And so I think it is about us having this opportunity to birth a future really of our own design.
Let's get into how we got here. There's much has been made about the greatness of this country and all of our many alleged resources. And as Tim pointed out, the very stark reality for all birthing people, and then when it gets to Black folks, the numbers are thrice as high. This country has one of the lowest ratios of obstetrician, gynecologists, and midwives per live births across identities. Latham, I would love to talk about just sort of how we got here and the work your foundation does.
I also want to just, before I get there, just shout out the fact that we're actually even having this conversation in this moment, and that you opened it for us in this moment, the courage that it takes to actually stand inside of this whatever's happening in DC, but that's affecting the world, and how people decide to deploy resources, programming, the policing that's happening over language and how we gather. And so it's even in this moment a privilege to be here together like this, and not be policed and not be harmed and not be surveilled, and to be able to be amongst people who have like minds, but also who are solution building. So I think we should just like take a moment to acknowledge that, give ourselves a round of applause. And you, thank you for lifting her and supporting this vision. It's really important, and it has to continue, and people have to be courageous so that we can continue to tell the truth. And so, sorry. So, so how we get here, I mean, this is an experiment of systemic racism that has fueled the nation. And when we think about where we are now, we start in a world where chattel slavery begins with Black bodies arriving on these shores over 400 years ago for the purpose of human capital, building a nation, right, that was nascent, that was really an experiment, right, that we're still actually living and unfolding. And the rudiments of this system are embedded in every single institution that we have. And in fact, every institution that we have is carceral in nature, because it also is tied to systems of slavery, right? And so these systems also were about extracting labor, extracting resource, and also inflicting pain, fear on a population of people, and to advance capitalism, right? And so capitalism in its purest form was based on the brutality of Black bodies and Indigenous bodies in this country, right? So we have also medicine moving alongside this rapidly developing form of commerce that was global, right? And medicine, we have what becomes obstetrics and gynecology, very nascent forms of medicine, not respected in the 1700s, by the way. And at the time, you have doctors really trying to prove themselves and using slave hospitals to experiment on Black bodies. And what enslavers would do would be loaning out the bodies of Black women for profit to these hospitals, where they would be forcibly operated upon, experimented upon. No anesthesia was provided, even though anesthesia was widely available at the time. And this is how we have a lot of the medical advances that were made to support and actually benefit white women at the expense of Black women. But also, it wasn't so that the medicine could actually help Black women, it was actually to keep them able to just have babies, right? And so it's like, how can we continue to harm, but also make sure that we can extract, children from them and more labor, right? And so this is embedded in our medical system, and it hasn't been addressed. There hasn't been any reconciling or any reconciliation, any retribution. There has not been any conversation about how we form an entire system upon blood, right? And the spilling of blood. And so we start here, and then that becomes sort of the model for how we think about Black bodies. At the time, we have phrenology as a science, right? As well as eugenics, right? Which shapes also how people are thinking about Black bodies. So you think that Black women are impervious to pain, which still is pervasive today, right? You think that a Black pelvis and a white pelvis are different when they're not, right? And science tells us that, but eugenics tells us otherwise, right? And so we even have today where people are still teaching eugenics in schools, right? Like, you still hear people talking about the differences in our bodies in this way. And so that's why people think that Black people are inherently sick, or somehow there's a reason why they're dying in childbirth, when it's not that we're different, it's that it's racism that's the problem, not our race. And so all of this, if you really think about where we are now from the 1800s, the actual trajectory of maternal health has not changed since the 1800s in this country. I'm just gonna say that again. The trajectory of maternal health has been on decline and has not improved since the 1800s. in this country. So that should tell us a lot about where our priorities lie and what's important to people in this country and what's important to our legislators, our policymakers, what's important to people who deploy health funding, resources, why we don't have birth centers in our communities and we have to build them ourselves because we built systems against midwifery in this country since the beginning, right? We have only 14,000 midwives in this country. About 6% identifies people of color and less than 2% are Black. Less than 2% are Black. At the exception of this country, everybody was born by Black or Indigenous midwives. So how do we get to a place where there's 37,000 OBGYNs and only 14,000 midwives? A stark difference that you don't see anywhere else in the world where there's a higher midwifery to obstetrician ratio everywhere else. So this has to change.
I'm gonna stay here one more second before I go to the next question. Can you talk a little bit about the foundation and the training programs you have that help create solutions in this space?
And I'm sure we'll talk about it more, but at Mama Glow, we have a maternal health and education platform, training doulas, nurse care managers, and really addressing these care gaps, right? Because we realize that if we don't center ourselves and center our story, nobody's going to solve, right? And we all know this, which is why everyone in this room is solution building, right? And so for us on the foundation, we provide pro bono doula services, everything from education and support for families and community members, as well as community care workers and nurses. But one of the things we do, in New York City, where I'm from, I should say where I live. I'm from California, but I live in Brooklyn now. Brooklyn. So we provide pro bono doula services for New Yorkers they are Medicaid eligible if they've aged out of foster care, if they're unhoused, if they're a migrant, if they're impacted by intimate partner violence. If they're a teen, they can get a doula from us. And so we do that for all of New York City. And then we developed the Verse Doula benefit for Anthem Blue Cross Blue Shield. And we do that for the federal employees. So we service 2.2 million federal employees in this country with a doula benefit as well, which took us about a year to do, but it's done and it's out in the world. And so for me, it's about how can we make impact? How can we penetrate these systems? How can we find ways to access the capital and also the resources, but also the people inside who can funnel money towards these programs to make sure that they're sustainable, because as you know, it's very hard. And people underfund Black-led organizations and POC-led organizations all the time. And most organizations that you think are doing amazing, you're look at the incredible work they're doing, they're underfunded. They get anemic amounts of money to function because people don't think we know how to actually deploy the resources. And so it is so important, like you said in the beginning, to put money into community, even if you only have a little bit to give, because it does really help a lot.
Thank you. Something that I have noticed repeatedly as auntie of all of the things, I literally have a t-shirt with the Dr. Susie things that my brother got me because I have so many nieces and nephews and nibblings. What I have seen over and over again from friends, family, colleagues is how overwhelming navigating pregnancy is, because there's people get confusion, they get overwhelmed when you talk about building a birth team. I had a friend who was like, "What do you mean a birth team?" Because a lot of times people just think they go to the doctor and then it's all done, and maybe in a safer situation that would be the case, but that's not. Stephanie, can you talk about building a birth team and breaking down the roles of doulas, midwives, and the many facets of the team in general, and also roots and the very historic nature of you in this state?
So it's a loaded question, but I hope I answer all of it. So I'll start with what the differences are between doula and a midwife. So a doula is in a supportive role for the pregnant person, but there's variety of different doulas, but in this context, we'll talk about birth and postpartum. And they are the person to encourage you, to support you, to educate you about childbirth, about labor, about postpartum. They can be advocates when you go into a hospital setting, birth center, or even at home. They are the person, like Latham said, kind of fill the gap, if you will. So a lot of families are not aware of like how their body is actually growing a baby and what that process looks like, and it's all very brand new. Or they take bits and pieces from friends and family. Oh, my labor and birth was horrible. Or, as soon as you find out you're pregnant, oh my goodness, you're gonna be sick the whole time. All these kind of negative adjectives in relation to it. And so the doula is there to help navigate that space, help educate in that space, hold your hand, encourage you in those hard moments in the hospital setting, to be an advocate for you, to answer questions when providers are telling you you should do these things. And if they are fully aware of sort of the birth process, they know like not everything is black or white. There's typically a gray area. And a lot of times we don't know what that gray area is. So we tend to just jump right in. And then once you kind of go through the process, you're like, oh, wow, I didn't know that I could have asked not to have that C-section in that moment because everything was good, but this doctor wanted to get off his shift type of thing, right? So anyone, and even so for myself, transitioning, talking about what a midwife is, even my clients, I advocate for them to have a doula in that space as well. So I am a midwife, I'm a home birth midwife, so it's a little bit different than what a lot of people are familiar with. There are different types of midwives. So there's nurse midwives, which are what most people are familiar with. They're in the hospital setting, they have a nursing degree, and they went on to get a master's in midwifery. Some, at least here, they work in the hospitals, but in some states, they can also work in home birth settings as well. I chose not to do, even though I did go to nursing school, I chose not to do the nurse midwifery route because I wanted to be separated from the system that I knew was harming us. I wanted a little bit more autonomy in how I practice, safely of course, but I wanted to have choices. I wanted women to know that they had options to birth at home. And so my practice is we do the same thing. So what a midwife does is a clinical care. So similar to what an OB does, they follow you through the prenatal process, through the labor, the birth, and then the postpartum. I do the same thing. I do the same labs and ultrasounds and all of the kind of screenings and testings. The difference is I view labor and pregnancy and birth as a normal physiological process, not a medical event, not a medical complication, because our bodies were built and made for this, right? Granted, I do see low-risk clients, so I'm not seeing people with other morbidities or medical complications, but coming into this space, even for someone who may have other comorbidities with pregnancy, you still can seek the care of a midwife because we talk about nutrition. We talk about how to be healthy. We talk about how to prepare for your labor and birth, how to prepare for your postpartum. In my case, I have the partners with them during their visits. In fact, I encourage it because most times the dads always have questions. Oh my goodness, I didn't know why she was yelling at me all day and all week. And I'm like, oh no, that's hormonal. But it also, she's growing a baby. She's tired. You have to help her. And so we have these conversations. We are building relationships with clients, right? So in my practice, they're like family. I know them from the moment they start care with me, and I have several clients, and there's a few in here, including Nashira, that even years later, we consider ourselves, kind of a family unit, if you will, a community family unit, because that connection is made. And so even in the space of everything that's happening in the world as far as maternal health and sort of all the negativity, there are still bright lights out here. myself included, and there's many midwives out here that are doing the work, that are trying to make the changes in the hospital settings. I don't see them in there, but I knew they were coming. I have midwives in hospitals that I can call up. Hey, I have a client that's going through this or that. Can you, do co-care with me, so that I know they're not just kind of thrown in the wolves, right? And if everything goes well, they can come back and have a home birth. If not, we can transfer care to this midwife in the hospital setting. So those relationships are what I think we are trying to build collectively when we talk about solutions, right? So again, home birth isn't for everyone, but for the people who are healthy, who are choosing a holistic and more traditional way of labor, birth, and pregnancy, this is an option. And for those that are not, going into a hospital setting with a midwife, having a doula be by your side in those spaces, because when you're birthing a baby, trying to make major decisions is not it. And they know this, right? They kind of, they know that you're in a vulnerable space. So they're going to tell you all the bad in that moment, right? But if you are educated, if you know you have rights in that space, you know that you could question things, I feel like most people have a little bit of a better experience in that space too.
Can I jump in for a second? Well, two things. I wanted first, because I know that we've got some doulas in the room. So can we see where the doulas are at? Yes. And where are my midwives at? Yes. Everybody needs a doula. Everybody needs a midwife. So shout out to all of you. And yes, I was lucky enough when Stefanie was, I think, finishing midwifery school, was one of the hands that caught my son at home in Mattapan, who just finished first grade yesterday. So and every time it's Noelle's birthday, I text Stefanie and I say, your baby's turning 7. So we share a baby together. That's the relationship between midwife and family.
Have lots of babies, roots babies, yes.
Yeah.
Can I also jump in as well? I just also wanted to lift up in terms of the birthing team. As a perinatal movement psychotherapist, I'm also going to put in a plug for folks to also explore considering having a perinatal psychotherapist work with you from thinking of having a baby to pregnancy, to if there's difficulties or challenges, to also postpartum. So I just wanted to also put in a plug for the few of us that are focused on perinatal mental health as well as therapists. It's something I think could be intervened as soon as possible. As soon as you start thinking about it, if you already had kids, and some folks will say, oh, the postpartum period is, I'm not in postpartum anymore. And I'm like, yeah, but it's still helpful to have someone objectively hold space for you when it comes to specifically your perinatal experience.
What all of you have talked about thus far lends itself to safe spaces and what it is to cultivate a safe space in your birth experience. And I also want to get into safe physical space. And that's where I think about the neighborhood birth center. I know you have a physical space in New York. Let's talk about it. And the center should be here. It should be open now. In
10 years.
liberal, allegedly open-minded Boston, this should not be a thing that any of our neighborhoods is fighting against. So I want to put that out there very boldly. For people who don't know, can you break down Neighborhood Birth Center, its journey, and where we're at?
Yeah, absolutely. Thank you. I want to go back to what Latham said about how we got here and just acknowledge that, in doing this work, it's been about 10 years that we've been working to open this birth center in Boston. And when I leave the Boston area, folks say, there's no birth centers in Boston with all that healthcare. And in fact, I think that's why there's no birth centers in Boston, right? Because we have, the hospital-based obstetrics have been systematically advantaged to, the consequence of community midwives. And so, not my board members and staff, but how many folks here know how many birth centers are in Massachusetts? 1. Yeah. in this, mecca of healthcare. There's one, and it's out in Northampton. It's beautiful and sweet. But there is not one in Boston, and there hasn't yet been. And so this is a vision that doesn't start with me. This is a vision that belongs to probably generations of midwives, but certainly some elder midwives in Boston who longed for a safe out-of-hospital place to practice. And in the early 80s, they were met with resistance. They were met with, hospital pushback. They were met with, naysaying from community and from providers about whether or not it's safe. We're meeting a different kind of resistance right now with zoning and regulations. But it has been a long path to get this birth center open. What we're clear about is that midwifery, and specifically community-based midwifery, is the key to reversing and changing this crisis that we have in maternal health and the ways that it bears down inequitably in communities of color. Birth centers improve outcomes, improve experiences, and return really significant in the billions of dollars back to the healthcare system. And so the question would be, well, why don't we have a birth center in every community, right? And the answer to that is structural. That the ways that most birth centers have opened in this country is by a singular midwife, like Stefanie, a home birth midwife, deciding to hang up a shingle and remortgage your house and open a birth center in that space. And that is just a pathway that is, one, I would argue, not sustainable and working well for anyone, but certainly with the ways that wealth is racialized in this country is out of reach for Black midwives, right? To remortgage your home, take out debt, to open a birth center, then to go without a salary, and then to not be able to get reimbursed appropriately by insurance. And so the work of Neighborhood Birth Center has been, yes, to open a physical space, but also in a lot of ways to experiment with correcting that, right? So we are turning to philanthropy and to the state to finance this. We are thinking about how we create a model where we are paying the midwives well, right? Where we are accepting mass health, where we are not turning to only those who can afford to pay cash can get that kind of sanctuary, spa-like, home-like, out-of-hospital setting for their birth. And so our work has been both about the physical space and getting the zoning and the design to do that, but also about kind of cracking the code to how we do that economically to create a model that we hope then can be replicated in other communities. And so while we work to get our shovels in the ground in Boston, we are already exploring our second location up on the North Shore. And I think, in the next 5 years, there will be birth centers in many Massachusetts communities.
Steffi, you touched on mental health, and I definitely want for people who might not know or be familiar with movement psychotherapy, break that down. But I also want to get into the portraiture as well and just the beauty of that, because both of the things you're doing in this space are really about creating space, about releasing turning the needle down, releasing the pressure, because there is a lot of negativity, not just with the system, but also with, you carrying high, you carrying low, don't you eat them cold cuts. It's just like a lot of, a lot of pressure and, with mental health, with movement, and then with the portraiture, you're really, let's get into it.
So I think it's really amazing to co-journey with folks who, wherever they fall on the spectrum, I'll say perinatal, to hold as someone who's maybe birthing and actually physically holding, or the desire to birth. As a perinatal psychotherapist, we get to hold their stories alongside them. And then as a perinatal photographer, being able to co-journey with them as well to document their life, which for me feels like very much rooted in liberation. A lot of the folks that I have worked with, whether as their therapist, or a perinatal therapist, or as their perinatal photographer, it's really asking them about the meaning making of this experience. And just to give context, my reason why I'm in Boston is because I came here for grad school and I did not I didn't know that this world existed. I didn't know that there was a space in the mental health sector that specifically focused on the perinatal mental health. And I also am the youngest in my family, so I didn't grow up with a lot of kids. So it was like a very different concept for me. But doing home visits in grad school, I was like, there's something here. There's also a vulnerability of like meeting someone who's either just had a child or they've been trying or they've been experiencing miscarriages or just any adverse experience, living in an intergenerational home and it's your first pregnancy and your parents have a different perspective of, you know, how you should raise this child. That's the holding space. And I'm always, it's very, very reciprocal. And it's also something that I don't think a lot of people think about in terms of who's holding them when they're expecting or trying to conceive. Also, the baby's now here and your body's different, you feel different, support or your needs may look or feel different. And so that's why I was jumping in before to say, if folks aren't aware of what perinatal psychotherapy is, it is a space where we are centering perinatal mental health. Perinatal mental health is from conception to about a year when the child is earthside, but I always push that postpartum is way past the year, right? In terms of the storytelling piece of it as well, I always tell folks I learn from them, I learn from their stories, I learn from whichever chapter they feel like they're embarking on. And when you hear photography, folks will be like, well, there's a financial barrier. For me, I just start with the co-journey. Like, what does this experience mean for you? I also didn't plan to be a perinatal photographer, but to lift up where this event started for you, Jeneé, I had been working as a therapist, as a perinatal psychotherapist in the field. And it was good because my work was out there. In 2018, a very good friend of mine asked me to do her photos. And I was like, never done this before. I mostly do portraits for folks who know. It was a beautiful shoot right there in the fence. She was from Dominica. She wanted it to feel like the islands. It was a beautiful shoot. A month later, her son was born sleeping. And that was the first person granted, I've been working in the field as a perinatal psychotherapist, but it was the first person in my life that I had known to experience the loss, and it just blew everything open for me. I was like, why aren't we having these conversations? Why? Even within my family, within my friend group. In my intro, I joke about being an auntie to many, and it made me really take that role even more seriously and understand, like, what is it about, what are aspects about pregnancy and fertility and reproductive health, just even reproductive health, that we just don't talk about. And for me, photography became the tool. It became the medium to amplify a lot of things. And through that, I've been able to, journey with folks to their doctor's appointments, or if they have their doula coming for the final visit at their home, they're having intergenerational conversations, really being intentional about how they capture their journey. And that's not really something that people, or at least it's still feeling very new to me in that space. But I'm always just saying to folks, think about whether you're pregnant or not, whether you're trying to have a child, whether you've had kids, how are you anchoring yourself in this time in your life? Photography, yes, I'm gonna push for it as a plug, but I think it's been really liberating, even just to be witness. And in most of those spaces I am, it is just really being able to see people take a very traumatic experience, for example, which can for some folks be childbirth, and reclaim it in a different way, reclaim their body in a different way. So whether it's through therapy or whether it's through a creative wellness outlet, I want to see birthing folks, specifically Black and brown birthing folks, reclaim their stories. Yeah.
Thank you for the way you see us, and also for leading by example and what it looks like to prioritize joy. Seriously. Before we open up to Q&A, I just have two quick, or maybe quick, we'll see, questions. I'm gonna try, James, I'm trying. I think something you all touched on is the importance of collaboration at all stages of this. So I want to just kind of touch everybody, take a moment, and if you don't want to take a moment and hop in, that's also okay. And also I will celebrate Latham, who just won a prize for doing this type of work that helps bring together these systems and spaces and people. You want to kick us off with the importance of collaboration?
Sure. First of all, thank you. I would say our team, I'm very blessed to have incredible people who believe in this work that have joined and worked so hard. And we developed, starting in 2023, we started working with CVS Health Aetna on developing an internal course for their nurse care manager team. And what was beautiful about that was that the women's health team there was really curious about how they could address care gaps and think about people who are of marginalized identities, and also develop a health equity track that they did not have. And we took our time, and we developed this program, which is a doula competency training that we offer for CEU credits for all their nurse care managers on commercial and the Medicaid side of the business. And we did everything from the program development, citations, like packaging, teaching, doing the polling, testing CEUs, all of that, submitting all of that for them, certificates, badging, everything to make it like engaging. But then also the manuals that they use for the course as well, and workbooks. And that just got an award from Fast Company for World Changing Ideas, which was announced on Tuesday. And so, thanks. And so then we'll be like presenting it at their Ideas Festival in the fall. But all that to say that like this type of work is really important at the institutional level as well. And now we have, if you go to mamaglow.com, mamaglow.com/yourbirth, you can actually download the guide, which is the consumer version of what we did for the nurses. And so this is a tool that the nurses will be using across teams within CVS Health Aetna, and what our doulas will also be using. And so it's free for everyone. It's available now, and it's a great resource. And so I would just say, like, everybody should go and download it, share it with, folks that you're connected to. And if you guys are in New York on July 18th, we're gonna have a huge party around it, so you can come. But the importance of collaboration to me is really like about shared resources and knowledge sharing in ways that, like you have something that I don't have, I have something that you don't have, like we all can bring our tools together and we can knowledge share and pour into each other, but also build something new. And we can only do that if we have humility and know that like we don't have all the answers. So when institutions partner with community, they know that they can't do it. And so it's really important for people to bring community into design. It has to be community-centered design for us to be doing solution building, because these people cannot do it by themselves.
Congratulations again. Also, just shout out to y'all, because so many of your questions are the questions that I had as well. So I love y'all real bad. Real bad. We go together. I always end with a beautiful resistance, but one of the questions that I had, that I was gonna end that after the Q&A, I was gonna end with a beautiful resistance, which I still plan to do, but because we all are thinking the same thing, I'm like, let's just real quick get into this part, which is institutionally and politically, what are the things we can do? Like, what are the things we could do to raise awareness? What are the bills we need to be advocating for? How we need to be civically engaged on this matter? What are the tricks and tips to put in our toolkit, the action items that you will send us off with? And as each of you give an answer, I also want you to plug your website, your book, your Instagram, all your goody good things. Anybody can start.
Totally forgot the question. I was thinking so hard.
Institutionally and politically,
Yes.
What are the tips and tricks to put in our toolkit, the ways we can be advocating, supporting, fighting for, holding space?
So from my space of midwifery, I would say the space to advocate and to support is that we need more Black midwives. It is the hardest. Getting through school was the hardest, and I've been in 2 different colleges, doula, lactation, you name it, anything birth. Midwifery school was the hardest education I ever had to go through. It's a space for, especially for Black students currently. There are so many barriers financially, emotionally, trying to find preceptors, doing an apprenticeship where you're working 24 hours a day, 7 days a week, and you got to put food on your table. You have to keep a roof over your head. There are very few schools, there's very few scholarships. And so I think the way to support this space is to, if you see a GoFundMe for a Black midwifery student, support that student. If you see, campaigns or legislature in relation to midwifery, make sure you show up. Currently in the state of Mass, we just became licensed home birth. They're working on the licensure for home birth midwives. And I have some thoughts on it that I won't share because it's a little bit long drawn out, but we're in the process now of building that licensure and what that could look like for the future. And my hope is that it does not become a hindrance for more Black midwives to enter this space, and essentially eradicating Black midwives, all of us, and kind of rewind. I'm the only one currently in the state of Massachusetts that's doing home birth. There are students, and they're kind of coming in the pipeline, but no one has kind of crossed the finish line. But I say that to say the history of Black midwifery, the reason why we're here is because we were eradicated through these programs that said we weren't good enough, that said, we weren't clean, we weren't educated, we weren't all these various things, but yet we were birthing communities for generations and hundreds of years and et cetera. So I think that's one way to support. The other part is to, support doulas, get yourself a doula, make sure that if you have family or friends that are pregnant, advocate for them to hire a doula, hire a home birth midwife. You can birth in your home. It's a comfortable setting. You can have who you want. You can have your family. And you build a relationship and you're working with a midwife who knows who you are, right? As a Black woman, as a Black birthing person, I know the culture that came with this. As myself who've birthed 2 children, I know what it's like to be in a system that didn't respect me, which is how I got here, partly how I got here. So I feel like that's, in this space anyway, that's how you can support midwives and getting more of us, because we are truly going to be the solution for our community, and we need more of us. How to support? I am on Instagram, Roots _ midwifery, Facebook, Roots Midwifery. You can find me at www.rootsmidwiferyma.com. And we are working towards, bringing a lot of different community-based things back to the community. COVID kind of shut it all down, and it's taken some time to bring it back. And me and my team are working towards bringing a lot of those programs and classes and support groups and things like that back to us. So you are in a space where people look like you, understand you, support you. And that's me.
Nashira?
Yeah, sure. You touched on something I was going to say too, which is I think, when folks show up in your life, are thinking about getting pregnant or are pregnant, ask them, have you thought about hiring a midwife? Have you thought about getting your care with a midwife? I think that we have a culture that defaults to obstetrics, and the majority of people can be safely and really well cared for by midwives in multiple settings: home, birth center, hospital. So that's one. And then I think, on the policy side, we are a part of the Bay State Birth Coalition. So I would encourage folks to go to that website or Neighborhood Birth Center website to follow all of the actions. We have a full-time policy director who's also a midwife, Catherine, who's here. And we, as a birth center that's not open yet, one of our first full-time hires was a policy director, because we were like, oh, we need to tackle the legislative and local policy context so that this birth center can thrive and that other birth centers may thrive. And so there's a lot to get engaged with for Massachusetts residents on the state level in particular. And we can be found at neighborhoodbirthcenter.org and on Instagram at Neighborhood Birth Center.
I would just say, build coalition. That's how we get through, how we can continue to sustain the work that is happening. How this work gets sustained is by other people in this room who have resources and who can come together and be in service of the mission, right? And so as you leave here, make sure you meet a couple people, because everyone here has minds, but also is doing things that could help each other. And so we can build community here. They don't want us to build community. That is how we literally stay alive. And so I would invite that to be part of how you in-source, right? Is through coalition building and remembering that these barriers are not real, and we're not in competition. We're literally trying to do the same thing. And so everybody is doing this work in silos, and then nobody gets it done because we're all working tiny when we could come together and do it big. So think about that and what cooperative work looks like, because that's what the movement has taught us, is to come together and be louder and also more intentional about how we work. So I think that's part of how we can design. Like I said, go to mamaglow.com, download the shared decision-making toolkit, and mamaglow.com, and I think Mamaglow on Instagram, it's the same thing. So hopefully we'll see you there.
I'll speak a little bit to the perinatal mental health side of it. So in terms of policy, I know that there's some things that happened recently in terms of the fund. I'm not sure if I'm saying this right, but the funding, the Act, Mom Act?
The Momnibus?
Black Maternal Health Momnibus Act.
Okay, was passed last year, but then the funding specifically for perinatal mental health, I believe, got funding recently. I'll also say to folks who are expecting or have recently had a child, ask your medical team about any perinatal mental health assessments. Ask them about supports. Ask them for resources, as well as, I'm going to echo what folks have said before, tap into more community that doesn't necessarily have to be just medical. Explore doulas, explore midwives, explore lactation specialists, also pelvic floor specialists are folks that you want to build. And then for folks like myself who are aunties, pour into your folks who are expecting or wanting to be. Think about different ways to help them document their stories, their experiences. Also, maybe joining a doula visit, for example, to say, hey, so Stephanie's not really thinking of, not for you to impose, but just to think about the postpartum period and what the reality of that is. Because I'm sure in a lot of spaces, it's wonderful to have a gender reveal. It's wonderful to have the big shower, but the first 3 months are not even just first 3 months. First year, it's a big change. And so for the aunties and uncles and grandmas and grandpas, also thinking about on a social level, how are you really seeing the person that's expecting? How are you really supporting them in that way? Checking on them with their doula appointments, their medical checkups. Really try to be active participants and co-journeyers with them. I think sometimes there's things that we just don't know. So how can you come to a space like this and be like, did you think about a meal train for, the postpartum period, the first month? Can I collaborate with you? Can I actually, as a part of your registry, put a doula on it, for example, or the cost for a pelvic floor specialist, or whatever the case is, being creative in that way. It can look very, very different in terms of support. So, yeah. Oh, sorry. So, for perinatal movement psychotherapy work, I have a private practice called A Bucket for the Well. I also have 2 photography collectives, the Diahann Project, and specifically for perinatal photography work, which again covers loss, covers everything, is Birthlooms. Yeah.
So I'm gonna pull just a few more quick questions. A lot of these have actually been answered already, and I just want to reiterate some of those answers real quick before I ask a few quick fire. When I do ask those quick fire ones, just one person take it, and then we'll move on to the second fire one. But there's someone asking about the funding landscape, and I know Nashira and Stefanie and Latham all talked about one, that individually we do need to donate, and also the dependence on philanthropic organizations. So that we did tackle that. And also, you made a really great point, and then it was reiterated across the couch, I love it, about it doesn't necessarily have to be either or between doulas and midwives as you build these teams. It can be a collaborative effort, should be a collaborative effort. 3 quick questions. How can youth get involved? And are there opportunities that any of you offer for students who want to get involved, or even students of midwifery or doulas? The second one would be with the closing of hospital-based birth centers and different things like that, how can we raise awareness around public education for midwifery and doulas? And how can people like doulas, midwives, and others advocate better for their clients? So those are the 3 kind of lightning round ones. Anyone can pop in and tackle one, and then someone can tackle the other and the other.
There were a lot of questions in there. I think that one way that folks can, there was a question about how folks can.
The youth.
Oh, that wasn't the one I was
That's
going
not
to
the one you
answer.
answered. There
I was
was
going for the last one.
Public education.
Yeah, my thinking is one thing, just in terms of like culture, right? We all create and are a part of culture, and I think that in where we get a lot of our culture is like television, right? And so I have, only ever seen rom-coms and movies where there is, a cis woman on her back hollering at a heterosexual male, get this baby out of me. And those are the images we have. And so I was on a panel last weekend, and a couple who's not even pregnant yet was saying, well, we just really are going to want the epidural. Mm-hmm. And it was because, and I said, well, where do we get that information? Well, that sense that every birth I've ever seen or heard about was painful. And so I think that in terms of culture, tell somebody that you met a home birth midwife, or that you met somebody who gave birth at home, and say, have you ever heard about that? And so I think just part of that is about talking about that and the history and reclaiming that, so that when we do open a birth center, there is a sense that like, oh yeah, I know that that's safe. I've been heard about that, because we can't count on the dominant media narrative to support those ideas of how we reclaim that memory, that ancestral knowing that we have. And so I think just part of that is talking about it. I think Instagram is another place, or the interwebs, just another place that people are sharing birth photography, in ways that wasn't really the case when I gave birth 12 years ago. There weren't a lot of pictures being shared. And so I think that there is a way to follow those, share them, amplify them in your algorithm, share them with others. And so we see that and we go, ooh, I think I want to do that, right? Or even if you have to have a C-section, you're like, I've heard about a gentle C-section, right? So I think that part of that is the culture. The more we can talk about it, the more we can stretch and understand what's possible.
Someone want to tackle youth and possible opportunities?
I think youth, I would say, take doula training as a young person. We've had so many young people, like the youngest I think was like 16, and she traveled in from Ohio, and we had to I had to sign on to be like her guardian while she was with us for the weekend. But we have young people, all like people like 70s and 80s, and it's intergenerational education, and it's powerful. But young people come because you're smart and you're faster than us, and you can do things, and you also have energy. And so, I teach at Brown, I work with young students, and what's been amazing is I have bioethics, medical anthropology, OB-GYN, public health, pre-med, and is that everybody? Almost. And all of those students, they pass through and they go into their discipline out in the world, and many of them actually chose midwifery. I had like 3 get into Yale midwifery school. I have some that are at Columbia right now that I mentored, and kids that I watched along the way. And so it's like, find those adults who are pouring into you, that believe in you, that you can sit at their feet and learn from. Reach out to organizations, write a good cover letter. Don't chat GPT, write a good cover letter. Reach out to people, ask if you can volunteer or if they have internships. A lot of people have internship or fellowship opportunities. We have a fellowship with Brown, with Tufts, with a bunch of other organizations and schools. And kids can come, and we usually hire the people who do our fellowship program. So you get to look to see like what organizations are doing things like that, so you can get involved, but also be around other young people who have the same excitement, because people always think like, oh, I want to meet all these people up here. No, you got to meet already right here, right? Who's in your same community, who's going to grow with you. So you guys are going to be the ones who change and shape the future, right? And so find those people that are young like you and inspired, but also find the organizations that can help catapult you, so that when you do go to med school or wherever you're going to go next, that you have that foundational work of like having done research, having done, partnerships work, having done coalition building, having done advocacy or legislative work. You can actually bring all those tools and become a really great candidate for where you're going to go next, if it is hopefully midwifery school, by the way. Yeah.
Can I also add a different perspective to that question around youth? It made me think about the work I do with siblings and like the conversations or worries that maybe families have about how do we talk about baby, how do we talk about your baby brother, baby sister. And it made me think about the many amazing children's books. I thought about literacy and creative wellness. Get a disposable camera. Give your child or yourself opportunity to capture that journey for you as well. And then there's so many books. I mean, I know right now books are being banned, and that's a whole other issue. But there are so many creative ways that you can really go down to that child's level or come up, because I think they teach us. And think of different creative ways to engage them in the conversation so that they can be a part of the journey as well. So it kind of took me to what is the familial experience of like talking about this with families, and also intergenerationally, bringing grandma and grandpa in,
There's a book called The Women Who Caught the Babies. Just buy it for the children in your life or the adults in your life.
Can one of you touch on combating burnout? Because a lot of times the people who take care of the people are not taken care of.
That's a whole segment. The burnout of who? Of
Just combating burnout of the doulas, of the midwives, of the psychotherapists, of the people who are caring for the people.
I think that's a loaded question that may not be answered in a few minutes.
Just a few tools. But just like a few tools. We all have different tools. Meditation. Yes. I don't know what.
No. What I was going to say is trying to fit in self-care is important, right? And it also depends on sort of your schedule, because the on-call life can be hard. Setting boundaries is another one. Like for myself, an example of myself, I have a small practice, so I only do roughly about 30 births a year. But 2 or 3 years ago, we were doing 50, 60 plus births a year. And I was burnt out. So I had to take a step back. I still like this work. I still love what I do, but I also had to realize the toll it was taking on me. And, in this space, because we are giving so much of ourselves to other people, a lot of times we could forget us in the process, right? Particularly in birth work, we're not just caring for the person in the moment of labor and birth, but we're hearing the stories, we're relationship counselors, we're nurses sometimes, we're, variety of different things before we even get to the birth process, right? Or even the postpartum period. So like we're navigating the village, or if they don't have a village, what does that look like? And now we're like, oh my goodness, they don't have anyone. So we're throwing ourselves in there, throwing them to resources that are not always easy to navigate. So I would say like trying to carve out self-care is key. It can be hard, but trying to make it a priority, I think and boundaries are the probably top two things that I would say. But also pay your doulas, pay your midwife. People always think that, or not people, but a lot of times people do not view this as a profession. We are giving our lives, our time, our effort. We are in different crazy positions. Our bodies hurt, all the things. We need to be compensated. And particularly for Black birth workers, a lot of times we are giving it away for free. And not being compensated appropriately. And I'm not in any way saying for nonprofit, because that's a different animal, but the expectation that we should be doing this work for free is completely different. And we have to not only sustain the work that we're doing in the community, but also our livelihood. Because if we're doing all of this and giving of ourselves, but we are losing our roof over our head and not putting food on our table, is not sustainable either.
I just want to clarify one thing about the nonprofit. It just means that the structure is that we are non-revenue generating on the foundation, but doulas get paid.
Yes.
So so there is, No, I was like, I don't want people thinking that like it means that because absolutely. But also I think to point out what you're saying, like people don't value the work because like feminized work is not valued.
Yes.
And then racialized feminized work is even less valued, right? And so if you have a country that had enslaved people and then brought them into the home and saw them as like the same people that they were enslaved, like this type of work was not seen as valuable. It wasn't paid for. It wasn't paid for, y'all. And so now people are like, I gotta pay for this. And so, and if you're doing any work in the home, think about the value that you pay a housekeeper, a childcare provider, a babysitter, a dog sitter, like all the different things that you got, a plant sitter, you know, like all the things that you can pay for. But if I stay home and don't go to work and watch my baby, nobody wants to pay me to do that because we don't have a federal paid leave policy in this country. So instead I have to pay somebody and then take my behind to work, right? So we do not value this work, which is why culturally people don't want to pay for it. And then it's why people have burnout, because they're underpaid, they're overworked, they're doing work they're overqualified to do, and also work they're underqualified to do, because doulas are acting as social workers sometimes without a degree. So literally, to your point, pay people, understand that like this is work of the heart, but it actually is taxing on the body, and it requires a lot of mental and emotional exertion, right? And that shows up in in weathering our bodies, right? And so it's really important to lift up this work. I think, I just wanted to add to what you said, but this is so critical, what she's saying. Like, we do not value it for a reason, and that has to change.
I want to thank all of you for your questions. There are many more, but they came in sort of in a flood, and we have to wrap up soon. So please reach out to everybody on both sides of me, as well as people within the audience who work in this space and people in your neighborhood and community that work in this space to continue this conversation. I started this particular singular event inspired by the loss of Crystal, but the truth is I lost 4 friends all under the age of 45 last year, which is why James and I wanted to do a series. So this is supposed to be the first of a series around wellness topics. And it means so much to me that all of you came out to support this. And I want to keep this going. And we want to make it better. So share your feedback. Tell us what you need more of, what you need less of. Just don't cut out the dancing. But the ending question that we always end on is what makes your life a beautiful resistance. So before we release everybody to be in joy and be in community for a little bit, each of you just kind of share what makes your life a beautiful resistance. And please know that we see you, we value you, we love you, and we want to continue to lift you.
I think for my life, showing up, not just for my community, but for my family as well. On the days where I'm tired, I'm aggravated, but on the flip side, I just helped bring life in the world. And so that balancing act is why I do what I do.
I love that question. When I think about my life as a beautiful resistance, I see myself as working in service of midwives and returning midwives to the community. And so I come from a long line of midwives, and I revere the midwives in my life. And so I'm working to resist oppression and restore midwifery.
Love.
My life is a beautiful resistance because I get to be present in my life every day. I get to be anchored in my stories and be in relationship with others. I get to see myself in most of the people I'm around, which is such a privilege. And yeah, I get to laugh through this world and hear myself be present in this world. Yeah.
Thank you. My life is a beautiful resistance because of you. You can find me at A Beautiful Resistance. You can sign up for the newsletter at globe.com/ABR. And we will be back at the museum on July 11th with a big old celebration. And Crystal loves celebrating birthdays and loves shining on people. If you want to learn more about her, look up the Shine with Joy Foundation. But I want to divert our attention to Jeneé, who I'm not a mom, but I have a lot of babies, and Jeneé is one of them. He does work behind the camera for me at A Beautiful Resistance and behind the camera for many in this community, and his birthday is almost upon us. So we're gonna do the Stevie Wonder version of Happy Birthday and close this thing all out. Jeneé, stand up. He hates attention. Let's kick it off. Happy birthday to ya. Happy birthday to ya. Happy birthday, happy birthday to ya. Happy birthday to ya. Happy birthday. Thank y'all.